Good afternoon, everyone. It's my honor to have this opportunity to make this presentation. My name is Pengfei from Jinshan Hospital of Fudan University. Today, I'm going to talk about research and application of Chinese medicine formula 919 in chronic liver diseases. This formula 919 syrup is a Chinese herbal medicine that has been shown to be beneficial in the treatment of chronic liver diseases in both clinical and experimental study. Personal resume. I finished my bachelor course in Inner Mongolia and master course in Hubei University of TCM, doctor course in Keio University of Japan. Since 2002, I worked in Jinshan Hospital until now. Also, I'm a master tutor in Fudan University since 2016. I will report from the following 5 parts. Based on a series of symptoms of liver and kidney, and Zhu Bing Jinshan, that to say chronic disease accumulate over time lead to kidney diseases in traditional Chinese medicine. Using this method show good liver practitioner effect compared with the effect of traditional improvement TCM method, including symptom improvement. Under the guidance of this method, the Chinese medicine formula 919 was invented. 919 syrup, named since September 1991, is a Chinese herbal medicine mixture. Got national invention 3 times. Until now, 919 syrup research got 3 national nature science projects, published 13 papers, and Fudan for 919 syrup finished 1 monograph, and 2 won of Shanghai Excellent Invention and 1 won of Provincial Science and Technology Progress. The first application in chronic hepatitis disease, more than 30 years of clinical research confirmed 919 syrup in the treatment of chronic hepatitis B is safe and effective. It shows also no toxic side effect, significantly improve the patient fatigue, anorexia, down distancing, also corrective inversion of albumin, globulin, and anti-liver fibrosis effect. This is a paper since 1995, the hepatitis B virus, liver fibrosis, and non-chronic fatty liver diseases. The second application in NAFLD, it found that 919 syrup can protect liver and reduce enzyme in the treatment of NAFLD and exert a significantly anti-hepatic steatosis effect. Other circulation papers said that 919 syrup in the NAFLD rat model and so a reduce in the weight of that and improve in the liver hepatopathiological change caused by NAFLD. The third application in postpartum depression, PPD. PPD is a common prenatal complication which has a long-term impact on the growth and development of newborns. Its pathogenic remains unclear. We apply RNA sequence to sequence hold PBMC from PPD patients. We use Edinburgh Postnatal Depression Scale, EPDS, when score greater than or 13, and control subject EPDS equals 0. 8 gene associated with appetite regulation and nutrient response, including PPARG. To confirm the result of RNA sequence, real-time PCR was performed to detect the mRNA expression of PPARG in PBMC from control. We found PPARG was gradually decreased with increasing EPDS score. Using Lumina platform, we identified a total of 2164 significantly different expressing gene, DEG, with 724 upregulation and 1440 downregulate in PPD PBMC when compared with control PBMC. We established a postnatal depression mouse model, also did the RNA sequence analysis of this model. We found that 55 DGs were upregulated and 36 DGs were downregulated in PBMC sample, both from PPD patient and RS mouse. We also found PPARG mRNA expression in the hypothermia of offspring mouse is significantly decreased in IS group compared to control by qPCR. It is found that Navana syrup can expose postnatal anorexia, but specific mechanism is not clear. Combined with previous studies, we propose hypothesis that Navana syrup may expose postnatal anorexia by regulating PPARG related pathway. We use PPARG agonists, pigletun, in Chinese, 比格列通, to observe the mechanism of Navana syrup, TG. TG is Navana syrup on PPD. RSR mouse is used. 5 groups were designed. PPARG agnostic groups, Navana syrup high groups, middle groups, and sitting groups and control groups. We found Navana syrup until the hypothalamus expression of PPARG and components of leptin signaling pathway in mouse with postpartum stress. We also found that Navana syrup until the gastric expression of PPARG and components of leptin signaling pathway in mouse with postpartum stress. We found that Navana syrup also enter the level of gastric appetite-related protein level in mouse with postpartum stress. In summary, we found that Navana syrup improve appetite in mouse with postnatal stress by acting PPRG to induce crosstalk with the leptin signaling pathway. This mechanism was similar to that of PPRG agonists. Navana syrup also improve gut flower structure and change in the relative abundance of the gut flower, strongly correlated with expansion of PPRG and leptin pathway components. Using same model, the PPD model was successfully established after 3 weeks of 3 hours maternal separation and restraint stress. We propose a hypothesis that Navana syrup improve postnatal depression through the regulated intestinal flora. The result of Navana syrup, the depression-related behavior, the tail suspension test, and the forced swimming test of PPD mouse, the longer mobility time in the PPD groups compared with control, and this behavior improved in mouse treated by Navana syrup. This result is alteration of metabolized in the hippocampus. Eight related metabolites were selected for comparison between intergroups. Of which 4 GABA were of special interest. This result is alteration of metabolites in the feces according to the analysis by synthesis 8 until the metabolites were repeated at 5 until the metabolites have opposite trait in the 2 intergroup comparison. Conclusion: we found that Navana syrup could improve the symptoms of postpartum depression by affecting the structure and the function of intestinal flora, thereby until hippocampal metabolite, we compared the change in the hippocampal metabolite, fecal metabolite, and the intestinal microflora of control mouse. Mouse with induced PPD untreated, and mouse with induced PPD treated by Navana syrup, and found the 4 GABA in the hippocampus corresponding with PPD behavior. Now, based on the change in GABA level, multiple key gut bacterial species were associated with PPD. Metabolic marker that may represent the function of the intestinal microbiome protein in mouse with PPD are defined. This relation between these factors is not a simple one-to-one corresponding, but more like a network of staggered function. We therefore believe that the cooperation and function of the entire intestinal flora should be emphasized in research studying the gut and PPD, rather than changing the abundance of individual bacterial species. This introduce of this concept of unbalance may help clarify the relationship between gut bacteria and seismic diseases, while Navana syrup can regulate it and restore gut balance, like to restore the balance of yin-yang. In summary, a new theory of tonify the kidney and treat the liver is pursued. Under the guidance of this method, the Chinese medicine formula Navanas were invented. The application of formula Navana in 3 diseases above reflected the series of treating different diseases with the same method in traditional Chinese medicine, which have certain significances. This study was funded by the National Natural Science Foundation of China. One is the influence of therapy of liver practitioner, Navana syrup or appetite at the brain-gastric gradient pathway in mouse with maternal stress. The other is a mechanism study of improving postnatal depression treated with Navana syrup through the regulation of intestinal flora. Okay, that's all. Thanks my groups, Ms. Zhuang and Ms. Xu do the clinical research, and my student do the basic research. Thanks NSFC at Jinshan Hospital for financial support. Thanks you for your listening.